How you doing? Gavin here from the Growing Younger team, and today's workout tip Wednesday is about the good old rusty knees. Okay, so what we find is, and me, this is quite a subject close to my heart, is that I've had lots of knee injuries. I've had 8 knee surgeries between both knees, and you know, time after time, I went through like 6 years of operations, taking out meniscus, which is cartilage. They ended up doing some quite invasive stuff and putting wedges of bone into the shin bone and all sorts of nasty stuff. But we have lots of clients within Growing Younger that have knee problems, whether it be total knee replacements, whether it be cartilage tears, all sorts of stuff, you name it, we get it here, okay? And one of the big things that we look at and what we see is a lack of quad strength, okay? Now, like what we also see as well is combined with a knee injury, there's obesity with that as well. So what you find is that you get a very weak knee, you get very high volumes of weight on that knee, and it causes lots and lots of knee pain. So one of the things that we obviously want to try and do is to reduce the body weight first, okay? So we try and do that, which is a different subject. But once you reduce the body weight, there's less pressure going through the knee joint, as you can imagine, you know? And then what we try and do is strengthen the quad, okay? The quad. So the quad is there's 4 muscles in the leg, which is why it's called a quad for 4 muscles. But the most important one we really try and focus on is this muscle here. It's the teardrop muscle. It's the muscle that's inside the knee, basically, okay? And they call it the VMO, vastus medialis oblique, okay? So it's this big muscle, it's a teardrop muscle. Now, what this muscle is responsible for, it's moving the knee joint. So it moves the knee joint out like that, okay? It's the main driver to pull that. And it stabilizes the kneecap. So that's really important to understand, because that kneecap sits and floats just on the front of the knee there. And if it's not stabilized, it moves around a little bit, and you kind of get like, you know, get pain. If it's not aligned, you get lots of pain and stuff, and patella tendonitis and that sort of thing. So what we try and look to do is strengthen that. Now, one of the best quad exercises out there are squats, okay? But what you got to understand is that some people can't do a squat because the knee hurts. And because there's so much weight on the knee, it makes squatting really difficult. So what you need to do is take a couple of steps back and go, right, what can we do to isolate the quad muscle that's not going to hurt it you know, down the track? So you can strengthen this up, you can work on losing weight at the same time, and then hopefully once this joint gets nice and strong, and the weight comes down, you're going to have less pain overall, okay? And like for me, I'm going through 8 knee surgeries. It's super important to do this. So what a lot of doctors and physio recommend is cycling, one of the best exercises, because it's non-load bearing for a start. So you're not putting all your body weight on there. It's the resistance of the pedals that causes the overload. But there's a couple of other things we can do as well with a simple band exercise. So I'm going to take you to the gym in a second and show you that. Just to go back as well, I'm going to put a little video just up there, and it's the knee extension, okay? So what you got to understand is that knee extension and leg extensions are not great exercises really for doing this, because it's something called an open chain exercise. An open chain means that your foot is not in contact with the floor, and it means that when you're moving your leg back and forth, if your toes are out, or you know your foot's on a different angle, it can cause pressure at different sides of the knee, okay? It has its place for sure, but the exercise I'm going to show you is going to be way better because it's more of a closed chain exercise, which means that the foot stays on the floor, and means that when the foot stays on the floor, the muscles around the leg fire exactly as they should, and it's way safer, way better. You're not going to have an injury doing it, okay? So I'm going to take you out in the gym, show you what to do, and you can give it a try yourself. Right then, so you got to, in fact, I'll take the band off to show you. So you can get these bands from, I don't know, any good sort of sports shop, okay? Different variations of them, harder or easier, lighter, heavier. But what you want to do, you want a closed loop one, okay? And you're going to loop it through or connect it to I don't know, a pillar or post or a door or anything. And you're going to put your leg inside, okay? And what you're going to do, you're going to take a step back until there's a bit of tension on the band, and your knee is going to be sort of bent, okay? You're going to be up on your toes, and what you're going to do, you're going to step back, and you're going to feel that muscle light up straight away. You can take it back slowly, and take it back down. You can hold on the door or frame, whatever, if you want to do it. If that's a little bit too easy, you can take a little bit further back and get more of a stretch. So keep the ball of your feet and then put your heel straight on the floor and squeeze that leg. Because as we understand now, is that the quad is responsible for moving the knee joint. When you put resistance on it, I'm straightening the knee and I'm causing that quad to light up right in front of you, okay? So I'm going to try and give you a different angle to show you. Take it back, so a bit of a bend, and push it straight back down. And you feel that muscle right there, that quad, light up. I'm going to do this for about, nice and slowly, feel the sort of muscle work. I'm going to do it for about 15 to 20 reps, because the idea of it is to get the muscle firing, muscle working, moving forward. Then obviously as you get stronger, then you can obviously add another band, or when as you get stronger in, you can add in a squat, and that's going to really help work on that muscle. So there's a couple of things to think about with that. Some people got like sort of sore skin and stuff. So with a band, what you can do is you can put a towel or something behind the back of the knee, and then do it, and it's gonna make it a little bit more comfortable for you. But ultimately, it's a really fantastic exercise for anybody with knee pain that needs to build up that quad muscle, that struggles with squats, has a little bit of knee pain, it's uncomfortable. This will basically solve the problem for you. So that is really it from me. If you've got any comments, if you like the video, please leave a comment down below. Just give a thumbs up, whatever you need to do. Helps the video get out for other people to see it. If though, you've got some problems with your knees and you need some help and you have no idea what to do, and you know that you need to do something, then look, there's an expression of interest form down below. Pop your details in there, I'll give you a call, we can have a bit of a chat about your current circumstances, and we can see if the Growing Younger program is right for you. Obviously we've got Alex who's a physio as well, and he has some input into these programs as well, and it's really cool to be supported and in this kind of program. But anyway, that's it. There's also a few links down below as well, for if you've got any problems and you need some help and you're not quite sure what to do, a couple of solutions down there for you. So hope you like the video. Please leave a comment, please share it to somebody that you know who has a knee problem and may benefit from this video. And like I said, we can get everybody moving, and don't let knee pain stop you, okay? Like I said, 8 knee surgeries in the bag, and I'm still moving. I'm pretty much 99% recovered, and it's because I do these kinds of exercises. So have a really good day, guys. Speak to you soon, and I'll see you on for Food Tip Friday.